I've talked before about the fact that one of the biggest challenges states face generally with the rollout on this is not a lot of visibility into how far ahead you can look with respect to what you can expect to get from the vaccine program, and that means we're sort of working on a 1-week window into what happens next. We get told on a Tuesday what we're going to get the following week, and the basic message from the federal government has been, well, we don't think you'll get any less, but there really hasn't been anything about any more. And we have about 660,000 people who are in what we call phase 1, which are the folks that we've talked about, the folks who work in healthcare that are COVID facing, residents and staff members at long-term care facilities, home health aides, visiting nurses, you know, the people who are first responders, the people who are really right there on the front line facing COVID, or most heavily at risk for issues associated with getting COVID or being part of a congregate care facility where spread can happen quickly. So 660,000 people in that group, approximately. We've received, you know, roughly 420,000 doses so far. We've been told that we can expect to receive somewhere in the general vicinity of 80,000 doses a week, maybe more, depending, which is one of the reasons why we've been sort of focused on making sure we get through this group of 660,000 based on the worst case scenario, which is that we don't get any more doses than we have gotten on a weekly basis so far. And I think we don't have any visibility into the production line on this. We don't know what Moderna or Pfizer has coming. And I hope one of the things that I and others have expressed to the incoming administration is they really need to find a way to create more clarity and visibility for us around what exactly is coming in the pipeline going forward so that we can create capacity to actually execute on delivering shots in the arms based on some assumption about how much vaccine is going to be available. Well, I guess what I would say is no one at the federal level ever said to me to expect more. Okay, I mean, the message we got was you won't get less, and we've all hoped that we would get, in fact, more, because the message we received was that as production really starts to ramp up, you'll start to see additional vaccines being made available. But it sounds like, at least for the moment, the planning we've been doing, which is to assume we won't get less, is probably about where we should be, at least until the new administration takes office and gets a sense about what that pipeline looks like.